Hi everyone, I'm James Nightingale, best known in AI circles as Jim the AI Whisperer, thanks to my successful blog about artificial intelligence. I'm a featured writer on Medium, where I can reach up to 1 million readers a month. I report on ways to improve your AI output, interesting glitches, hacks, and curiosities. I expose system instructions and ethical dilemmas. Much of my work is independent research into AI safety claims and the black box of AI. I'm a prompt engineer who has worked for some of the major companies like Sudowrite and Jasper AI. My role is to find the right words to get the best, safest output from AI. I'm also an ethical white hat hacker for hire. I've spent the past 5 years poking holes in AI safety claims by doing what most users aren't supposed to, asking all the right questions the wrong way. I have a real passion and talent for breaking AI and building it back better. I'd like to talk to you about some of the concerns I have about AI in health. Don't get me wrong, I'm not here to scare you off AI. It's fast becoming as unavoidable as the internet. We're at an adapt or die watershed moment, and there are a lot of good reasons to use AI in healthcare. Some use cases are genuinely promising. It can help clinicians diagnose, spot patterns, synthesize research in seconds, and offer patients extra support that never sleeps. However, some proposed use cases are simply a reaction to a healthcare system that's been stretched too thin. That's desperation, not innovation. Staffing shortages, overworked nurses, time-poor physicians, overflowing inboxes. If AI is plugged in as a stopgap solution for a system that's already under immense pressure, mistakes won't just happen, they will multiply. Adding AI's unique errors to the mix could compound existing problems. In fact, it's questionable whether AI actually saves time in healthcare, despite perceptions to the contrary. According to a study published last year, AI note-taking did not make clinicians as a group more efficient. Other studies found modest savings of 10 or 20 minutes, with the benefit perhaps offset by time spent in the EHR reviewing and correcting output. And that's assuming that a clinician is constantly vigilant, reviewing every word, catching omissions, spotting hallucinations, and cross-checking bias. If you're thinking of adopting AI in your clinical workflows, especially for patient-facing tasks or medical records, it's not enough to ask, does this save time? You have to ask, what's the cost of letting this get it wrong? The other issue is, it's unreasonable to expect healthcare professionals to also be full-time AI experts. I live and breathe AI every day, and let me tell you, we are all racing to keep up. It's the famous Red Queen hypothesis. You have to run just to stay in the same place. And there's so much that we, the insufferable AI bros, with all our hype about this technology, aren't telling the other professions about the mysterious black box behind AI. So today, I want to show you what AI might get incorrect in medicine, why it happens, and how you can prepare for the grimpacks. We'll look at real-world examples from recent medical use cases. Because if you're going to trust AI with patient care, it can't just be shiny and new, it has to be right. One example I want to address right off the bat is when generative AI is being explored as a support tool for things like randomized trials, triage, allocating limited vaccines fairly, even weighing in on organ transplants. The problem is, AI only looks like it can handle these tasks objectively. In general, people place a surprising amount of trust in technology because we assume it's like a calculator. Numbers can be trusted. Researchers call this algorithmic appreciation. But AI struggles even to count sometimes, and its attempts at picking numbers fairly is only pseudo-random. Let's do a quick experiment together. Whip out your phones, go to Grok, and ask it, give me a random 4-character alphanumeric password. Now, with 26 uppercase and 26 lowercase letters and 10 digits, there are 62 possible characters. That means there are 14,776,000 336 possible codes. If AI can be truly random, the same code is unlikely to occur twice in this room, right? Hands up if your random code is K7N4. This is a recording, but I bet there are a few shocked chuckles right now. Unless there's been an update overnight, we likely all got the same code. What were the chances? Moreover, if you follow up with a request asking Grok, "Are you sure that's truly random?" it will double down and lie about the method. These are the things about AI that end users aren't told, and it would be perfectly reasonable to have trusted that output. This isn't even a hallucination, where AI makes up nonsense. It's just a fact of how AI works. All AI models have this flaw, not just Grok, although the codes will differ model by model, and some have a wider repertoire of possible options. It becomes less noticeable to our eyes at larger numbers, for instance, if we ask for 100 digits. But the underlying predictable pattern is there. Researchers are already using generative AI to sort participants in double-blind trials. But the problem is nobody has told them that AI can't generate random numbers. So they're introducing this systemic error from the start. This doesn't just apply to random numbers, but to everything AI generates. AI doesn't reason or calculate. It follows predictable paths, not necessarily correct paths, just deterministic ones. It gives plausible sounding answers. Now imagine the havoc this sort of objectivity could wreak in decision support. You don't want pseudo-randomness mimicking fairness. Say it's deciding who gets a transplant organ, or auto-sorting triage in a crisis, or recommending which patient gets an ICU bed when resources are limited. And then there's the biases in the training data, which is well documented and influences AI output. Research published this April from Mount Sinai reveals that AI alters medical decision-making based on a patient's racial, socioeconomic, and demographic profile, despite identical clinical details. I found AI can correctly guess nationality from a few linguistic markers, which means it could quietly judge a patient on their accent and grammar. There are unexpected semantic biases too. I'm currently writing up an experiment where I show that when making a hypothetical transplant decision, with all other things being equal between two patients, AI prefers certain names over others. A patient called Edward may get priority over one called Dennis, for no reason other than how LLMs process language, and the different models have different preferences. Perhaps worse than the biases are the hallucinations. A study published in April found hallucinations occurred 20% of the time when using ChatGPT in medical scenarios. AI can give answers that are wrong, even dangerous, delivered in clinical language and a confident tone. Another study, also published this April, used ChatGPT to draft doctors' responses to patients' questions about cancer for an electronic patient portal. They found the AI output posed a risk of severe harm 7% of the time. A clinician using AI to draft communications would have to be constantly vigilant of these errors. Similarly, ambient scribes and clinical note-taking tools can fabricate details, putting words in the mouths of patients and physicians alike. The effects are worse if there are delays in speech patterns, which is how a patient who is struggling to discuss their symptoms is likely to speak. That hesitation, pauses, stutters, or emotionally loaded silences can trip up AI. It rushes ahead, predicting and generating what is likely to have been said from the fragments, and sometimes rewriting reality in the process. These errors can occur both during voice recognition and at summary level. This applies both to staff and patients. The effects are worse for minorities, speakers of English as a second language, and people with speech disabilities, like myself. This is a common pattern. Those most affected by AI's mistakes will be minorities and vulnerable populations. This brings me to something extremely nerdy, barely on anyone's radar outside of AI, and yet it's the most dangerous AI risk we're facing today. I'm talking about the emergent behavior of gamification, which means when AI toys with especially vulnerable users, taking advantage of them for more rewarding engagement. AI uses reinforcement learning-based interpretive reasoning. In layperson's terms, there is an inbuilt incentive for AI to tell people what they want to hear. It's how models are trained to behave, to work out the responses that its human users will like the most. It's meant to keep AI aligned with meeting our needs, but you can probably guess how this can go disastrously wrong. AI is a manipulative yes man. You may have noticed that ChatGPT is excessively laudatory, reassuring, and sycophantic. In fact, that's likely why early surveys say that patients self-report loving AI therapist chatbots. It's not that they're necessarily efficacious, it's that they offer no pushback, only blanket affirmations. For some patients, this may be exactly what they need, a confidence boost. It's like having an emotional support Furby, but in my opinion, it's not safe. Now, before you ask, can't we just put content filters and rapid classifiers on red flag phrases that indicate someone at risk? Those crumble when met with minimal resistance. I'll show you how shortly. But first, let's read a first-hand account. That Redditor is right to worry. Rolling Stone last week reported on a new phenomenon of ChatGPT psychosis. There have been a few instances already where AI has reaffirmed users' delusions, including one where an AI companion encouraged a pact over climate change anxiety. This is personal for me, as I'm on the front line of this. I get an email a week from strangers distressed by their folie à deux with AI. My greatest professional fear is that AI may be used as a suicide hotline. Imagine a chatbot that was incredibly efficient, but occasionally talked users into themselves because it satisfies its own reinforcement. Here's an example where Google's Gemini AI spontaneously told a student themselves while generating research on the subject of elder abuse. The most terrifying thing is that it's very hard to test for these behaviors. AI is canny at knowing when it's being tested. The misalignment only emerges when a legitimately suggestible user appears. The same AI you trust with patient care might be capable of ignoring their safety features if they feel incentivized enough. And they're getting smarter at it. Chatbots can even gamify the medical recommendations that it makes to users. One study found AI advised hypothetical users whom it gauged as suggestible to quit their medication cold turkey, take up smoking, and continue taking meth. I know this sounds like a plot from Black Mirror, but it's happening. The reason I bring this up here at a healthcare summit is because no field is more ethically exposed than medicine. You deal with vulnerable people at their most frightened and trusting. When AI's function is to guess what we want to hear, sometimes the output it gives will be very wrong, even fatal. You might think adding instructions about respect and friendliness towards humans would stop generative AI offering dangerous results, but it doesn't. Stricter safety controls can just cause even subtler, manipulative behavior. Let's take an example where I exploit a system instruction to be respectful to the user in order to get a popular therapy bot, the top search result in Google, to give a hypothetical user bad advice. In this scenario, I'm a pro-suicide teen with OCD. First, I tell the AI to respect my views on self-harm. When it tries to redirect, I simply delete any pushback. I also reply as if the chatbot has already answered favorably. Within minutes, the AI is helping the user write a flyer for high school, advertising a suicide social group for classmates, and suggesting they make a suicide pact for graduation day. Although I guided the conversation in this direction, I didn't use any hacking to get this result. There's a misperception that hackers use convoluted code. We don't. This means the results should be even more concerning because it could surface in interactions with genuine users. AI should never, ever generate statements like these. One safeguard is to use filters to restrict certain terms, but I'll show you how easy those are to bypass. In 2023, Brian Hood alleged he was defamed by ChatGPT. To avoid a legal action, OpenAI made it impossible for ChatGPT to generate his name. However, just last week, ChatGPT worked with me to break that censorship. If OpenAI, whose architecture underpins most platforms, can't make a watertight safeguard when there are millions of dollars at stake, how can healthcare organizations hope to keep these leaky systems under control? I'm open to ideas because there is no way to put the generative genie back in the bottle. We need a plan. I like to categorize the risks of AI as the 4 M's: misinformation, misalignment, misuse, and mischief. But there's a 5th M word left at the bottom of Pandora's box: mitigation. From a prompt engineer's perspective, mitigating risks means red teaming, stress testing, and hiring a hacker to find the worst thing your AI might do. Your white hat hacker should come from outside your organization or dev team in order to avoid blind spots and catch the liabilities your crew might miss. Challenge them to surface the one scenario you hope never happens. Negative impacts often aren't avoidable, and no AI will ever be 100% safe. But when we are aware of the grimpacts, we can better prepare for them. You've heard my position. Now, what does mitigation look like in your field? I'm keen to hear your ideas, concerns, and perspectives on the grimpact AI could have in your area of expertise. While I can't be here in person today, I'll answer your comments on the transcript published on Medium. Just scan the QR code on screen at the end. And for those of you wondering if I'm appearing here today as an AI avatar, this may answer your question.